Hello everyone, my name is Kia Rai and today I'll be presenting the article presentation assignment. Let me share my screen first. My presentation title is The Expanding Role of Nurse Practitioners, and I'll be discussing how this shift is influencing the US healthcare delivery system. This topic relates closely to what we have been studying about healthcare providers in the textbook, and I'll discuss both the article that I've selected and how it connects to the key concepts like provider roles, access to care, system fragmentation, and quality. In the textbook, a provider is broadly defined as an entity delivering healthcare services like physicians, nurses, hospitals, clinics, and many others. Today, I'll be focusing specifically on nurse practitioners, who are in short called as NPs. NPs are a rapidly growing segment of the provider workforce, and their expansion reflects larger pressure in the US healthcare system. For this presentation, I have selected an article titled as Nurse Practitioner as a Solution to America's Primary Care Crisis by Smith and Davis. The article was published in Health Affairs in 2023. I chose this article because it directly addresses a major issue we have discussed, how the provider landscape is changing due to the workforce shortage and the increased demand. The article uses policy data, workforce trends, and the outcome studies to examine how the nurse practitioners are filling critical gaps in primary care across the country. It is important to understand the broader provider environment described in the textbook. See and Singh emphasize that the US healthcare system is fragmented, with no central governing body and a mix of financial arrangements and service settings. This fragmentation, combined with an imperfect market where patients often lack cost transparency, creates challenges such as poor coordination, higher spending, and limited access. These system level issues help explain why expanding the NP role has become necessary. One of the biggest pressures on the system is the shortage of primary care physicians, especially in rural and undeserved urban areas. The textbook states that the goal of any healthcare system is to enable all citizens to obtain needed care, but limited primary care access works against that. Patients who cannot access primary care often end up with the more severe health issues and higher cost. This shortage is exactly the gap that the nurse practitioners are stepping into, which sets the stage for the article's argument. Let's talk about the article. The article highlights that the nurse practitioners are well positioned to address the primary care crisis. The nurse practitioners hold advanced degrees and trained to diagnose, treat, and prescribe. The nurse practitioner workforce now exceeds 355,000 nationwide. Crucially, many nurse practitioners work in health professional shortage areas, like places where the physicians are limited or entirely unavailable. This growth is shifting the provider landscape by increasing capacity where it's needed the most. In the article, the authors provide strong empirical evidence. They state that the MP-led care is high quality and cost effective. Patient satisfaction and outcomes are comparable to physician-led care. In state with full practice authority, the nurse practitioners can practice independently. Rural primary care capacity increased 20% more than in state with restrictive laws. So this kind of data supports the idea that the nurse practitioners are not only supplementing the workforce, but improving access and value. Now let's look about the textbook connection with the argument. This shift aligns with the textbook concepts of the continuum of services. She and Singh explain that the healthcare delivery now happens across many settings, not just hospitals. Nurse practitioners provide primary care, chronic disease management, and even retail clinic services, helping rebalance what the authors call a lopsided system that overemphasizes specialty care. In other words, we can say that the nurse practitioners strengthen the foundation, preventive and primary services that the US system desperately needs. The use of nurse practitioners also fits into the system's broader quest for quality and value. As healthcare moves forward toward value based care and SEOs, organizations must deliver high quality outcomes at lower cost. According to both the article and the textbook, nurse practitioners help achieve these goals. Their cost effectiveness and strong patient outcomes make them essential to organizations trying to improve care while managing expenses. The article introduces an important controversy, restrictive scope of practice laws. Many states will still require physician supervision for NPs, even though evidence shows NPs provide safe, high quality care. The authors argue that the restriction protect economic interests more than the patient's safety. This aligns with the textbook discussions about the balance of power among players, specifically how professional groups influences regulations to maintain hierarchy. In my opinion, the article's argument is more aligned with the realities healthcare organizations face today. There is strong data supporting nurse practitioners' effectiveness, and restrictive laws limit patient access and increase operational cost. The textbook notes that the health service managers must capture new markets, manage costs, and ensure organizational viability. So, in like from a management standpoint, expanding nurse practitioner practice is a strategic advantage. It's not a risk. Let's talk about the future implications. If we look into the future, I believe the nurse practitioner's role will continue expanding and shaping the future of healthcare delivery. The textbook highlights several trends integrating delivery systems, chronic disease management, and reliance on mid-level professionals. The nurse practitioners are central to all of these trends. As the population ages and chronic illness increases, nurse practitioner-driven models will be crucial for sustainable and patient-centered care, I believe. However, to conclude, the expanding role of nurse practitioners illustrates how the US healthcare system adapts to challenges like fragmentation, rising cost, and provider shortages. Nurse practitioners can enhance access, support value based initiatives, and strengthen the continuum of care. Both the textbook and the article make it clear that the nurse practitioners are essential to the future of efficient and effective healthcare delivery. However, I have listed the references here. The textbook and the article I have summarized and presented my presentation here. Thank you for your time. Thank you, everyone. I end my presentation here. Thank you.